we will discuss how infectious mononucleosis caused by Epstein-Barr virus is diagnosed.
This condition often presents with a combination of symptoms and physical findings that point toward the diagnosis, but confirmatory tests are needed to be certain.
Infectious mononucleosis should be suspected in adolescent or young adults who have a sore throat, fever, fatigue, and enlarged lymph nodes, especially if the nodes in the back of the neck are affected.
Additional signs like an enlarged spleen or small red spots on the roof of the mouth make the diagnosis more likely. On the other hand, if cervical lymph node enlargement and fatigue are absent, the diagnosis becomes less likely. Blood tests are helpful in supporting the diagnosis. An increase in lymphocytes, especially atypical lymphocytes, is common in infectious mononucleosis. However, to confirm the diagnosis, tests specific to Epstein-Barr virus are needed. These tests detect antibodies made in response to the virus. An alternative test called the heterophile antibody test is sometimes used, but it is less accurate.
Even though there is no specific antiviral treatment for infectious mononucleosis, confirming the diagnosis is still important.
It helps patients understand the risks, such as splenic rupture and prolonged fatigue, and why certain precautions, like avoiding contact sports, are necessary. Since some of the symptoms of infectious mononucleosis overlap with strep throat, such as fever and sore throat, it is important to also test for a streptococcal infection. This is typically done with a throat culture or a rapid antigen test.
By combining a thorough evaluation of symptoms, physical findings, and appropriate laboratory tests, doctors can accurately diagnose infectious mononucleosis and guide patients on managing the illness.